I have an expert on lifting after hip surgery with me. So, is it possible to lift after hip surgery or any surgery at that matter?
Yes, it is.
Yeah.
I think people get upset when I talk about lifting heavy after a hip replacement or a knee replacement because they've been told by their physician that they shouldn't.
Yeah.
And when we're looking at the general population, most people who are going in for replacement surgery don't have a training history. They're not necessarily athletic, except for knees, and it tends to be older runners or something like that who still don't have a training history. We look at the literature and they say, the average lifespan of a prosthetic is about 20 years, maybe extending a little bit longer. But when you're looking at the population on which that research is done, it's not the athletic population. It tends to be someone who has comorbidities and is overweight. So when we start saying, yes, you can lift when you have joint replacement, it is taking all of the athletic history that people have and knowing that I am much lighter than some of the stuff that's in the literature of overweight or obese men who are using the same prosthetic. And I'm going to put load on and I'm going to lift with it, and there's no issue there. It's not about wearing it down. It's about making everything strong around the joint and around the joint replacement, which relieves some of the pressure that people have in that joint and joint pattern, which is how a lot of people end up with replacement. So it's looking at how are we strengthening around the joint, even if you don't have a replacement. It's getting really strong in and around the joint so that you can alter the load within the joint to now have the muscles absorb it, which extends the life of any joint. So with joint replacement, just like any kind of training that you're going to do, you phase in and you are adding load as you go.
Yeah, and I think for men, there's probably a lot more history of male athletes getting joint replacements. So the conversation is a little bit better. I know a lot of rugby players in their late 40s, 50s have had hip replacements. And so it's quite a common thing. But I think as we're seeing more women who were high-level athletes come through, it's becoming more common.
Yep. And I'll talk to my surgeon and he's like, yes, lift, it's great.
Yeah.
Yeah.